Welcome to Treasure Coast Community Health, with 7 locations to serve you better. We have a dedicated staff. And now, here's your host, CEO Vicki Soule.
And good morning and welcome to Community Conversations. It's my pleasure each week to bring guests in that will talk about what's going on in our community. Everyone these days seems to be forgetting about their general health. All noses and mouths are pointed to the direction of COVID, and with good cause. We know that it is strictly a pandemic that is going to go on and on. So we all want to be in the know. We all want to be taken care of. We all want to put our loved ones out of danger through the vaccination program. And so we are doing our very best at Treasure Coast Community Health to do both of those jobs: medical, dental, behavioral health, and COVID. I laughingly call that our 4th service line these days. And hopefully we do as good a job at that as we have on our other services to you. But today I asked a very special man that I've known for some time, Robbie Brackett, who also happens to be the mayor of Vero Beach, to talk with us. He went out coffee with the mayor a couple of weeks ago, and I was fortunate enough to be there. But with social distancing, I know a lot of folks were a little bit leery, so I asked Robbie if he would come back on the radio and maybe talk about some of the same things, give us some updates, talk about things that are going on in the city. So I think our 24 minutes together are going to go lickety-split. What do you think, Robbie?
I think so too, Vicki, and I appreciate you having me on the air.
Well, it's my pleasure. You know, I was exposed to your family a lot sooner than I was exposed to you, who happened then to become my landlord for a while, our landlord at Treasure Coast Community Health, because of work that your dad had already done that was pointed out to me in the Fort Pierce area. Mm-hmm. So that tells me that you guys have been residents here for a very long time.
We have. Our family's been here. I'm 3rd generation. In the Vero Beach and New River County area. My children are 4th, obviously. My dad had a love for this community and a love for the city. And even in the Fort Pierce area, he went on a time frame where he actually went out and renovated old buildings. The old Florida Theater, the old New River County Courthouse, Similar Arcade, the arcade building in Fort Pierce, and different ones, and put them on the National Register. And that's kind of been his passion.
Mark. Well, it's definitely his mark. He has restored and brought life back to a lot of buildings that others probably did not see the potential over many new generations to come. So
he did. It's interesting. I have a lot of people tell me, well, you're in the development business, and I have to remind them we've never developed a thing. We've only redeveloped. We've never built our own office building from scratch, but we redeveloped a number of them and brought them back to life in the New River County area.
And so you and your brother are continuing that tradition under your dad's gentle fatherly guidance, right? Because I know parents never really retire.
Well, it's interesting you say that because my father still comes to the office every day. And so he enjoys it. He enjoys staying a part of the projects. We do handle most of them. My brother and I, actually my brother handles most of them, but he enjoys coming and being a part of them. So.
Well, and it's natural because your attention certainly has focused to other community things. Hence, you're running for council and now the mayor. And so I thank all of the family on behalf of what you all have not only brought to our community, but continue to shape the future with us. So let's talk a little bit about that, shaping the future.
Well, this community has been good to my family. And so we thought it was time to give back, or I did. Was approached by a number of other people. And so I decided to run for the first time back in 2018. Was successful in that race. Most of you remember we had to do it twice because we had a problem with the election. But we did it both times, and it worked out very well. And the slogan of my campaign was recalling the past while shaping the future. And that's kind of what we hope to do.
COVID got in the way, slowed things down a bit.
COVID did get in the way and slowed us down. But my goal right now, people always ask me, what's your agenda? And I don't really have an agenda. My goal is to get us back on track, bring some of the projects that fell off the bandwagon because of COVID and get them back on the table, and let's get moving forward with them. And so that's the goal. And we still have COVID, and so we have to pay attention to COVID. I think the week of the 10th to the 16th, we actually tested over 12,000 people in the county. And so that was big numbers, biggest day yet.
But that's good because
very good.
because if you test, you know your status at least at that moment.
Yes.
And so if you are positive and you were just thinking that you weren't, that should be the cue then. Quarantine. Don't spread it around.
Exactly. No, it was a good day.
Good thing.
Our positivity rate for that week was about 7%, a little over 7%. So we're still under the 10% goal that the state set. We don't
Five.
know. It's 5.
5 is really the goal. 10 is what we'd settle for, but 5 is really the
10,
goal.
So I apologize.
No, it's
but
okay.
And those goals, I remind people, are subject to change on a regular basis because this is new for us.
Yeah.
The CDC guidelines have changed drastically since March of last year as to what we're doing, and so it's a moving target.
Absolutely.
And we want to continue to try to hit that target the best we can. We're getting it out there right now, and we're on the vaccine stage, which the city doesn't have much to do with at all. It's more the county, but I do try to stay a part of it. And I think it's good to know that while there's some frustrations out there with getting your appointments, it's because it's a big demand.
It's a huge demand.
As you and I have spoke before, I think we've probably vaccinated somewhere over 12,000 people or 10 to 12,000 people.
Thereabouts.
And so it's we're getting the job done, but there's over 20 million people in the state of Florida alone. So it is a process.
And I think I think Tad Stone commented to the county commissioners a couple of weeks ago that they had 30,000 phone calls come into their center before it clamped down. So we know our county has somewhere around 48,000 people over 65. So that number didn't shock me, but it shocked a lot of people. It went 30,000. No wonder they were out in 5 minutes.
Exactly.
Okay. So to their credit, everybody is continuing to work to devise a better system. Treasure Coast Community Health has been out calling their own staff. We have a number of people who volunteered to assist us, which is wonderful. Because, again, we have 25,000 people that depend on us for their regular care. And, again, I want to encourage those of you who have not called in. We do have a new call center which separates out the COVID responses from the regular appointments. And so we want you to come in and see your provider. Your diabetes did not go away. If anything, working at home, staying quarantined, unless your refrigerator is empty, you probably are having way more ice cream than you did a year ago, okay? And if you think your body's suddenly gotten better at working it, guess again. Hypertension, high blood pressure. If this stressful situation doesn't raise your blood pressure, congratulations, you're doing a good job with your medication. But a lot of people are sort of falling off the healthcare bandwagon and focusing all their attention on COVID. But COVID isn't the only thing that can kill you. So we want to keep you healthy. We want you to have good oral health. And we do have counselors that are seeing people if you need a place to vent or a referral. So it's a team effort without a doubt. Okay.
It is. I've preached from the very beginning, especially since I became mayor, that just be a good neighbor. Okay, do the right thing, respect the people around you, just be civil, and we will get through this. And I think overall, my hat is off to our community. They have done a good job. You walk through the supermarkets, you walk through the big box stores, chain stores, and different stores, and people are respecting the rules of those stores.
They are,
and I appreciate that.
Yeah.
It's going to be a group effort to get past it all.
Well, and there are always going to be what I call the unbelievers, okay, that think that science or the media or both are not telling the truth, and so they're going to do what they want to do. That's what America was founded on. But we can't fight among ourselves. We have to respect that there are differences and do what's right as it pertains to friends, neighbors, and family.
We can agree to disagree sometimes.
Exactly. That's something you don't hear about much anymore.
No, you don't.
All the way from Washington down to locally. But we're better than that in this county, and I agree. People are showing it.
Yeah.
So if you have any questions or concerns about the way this is rolling out, I'd be happy to take an email from you. Expressing your concerns. We are trying very hard behind the scenes to ensure that our most vulnerable people are taken care of first, okay? Whether it's by age or by physical condition or neighborhood affiliation or whatever you want to say, everybody doesn't fit into one box. So thank you.
Thank you. I think the group is doing a great job at large overall. It's different. It's new to us.
And it changes.
We've never rolled out a vaccine like this,
right?
Where we had to do it to 20, just from Florida, over 20 million people eventually. And so it's a process, and we just have to be patient. And I think, as we said, be kind and keep trying.
Well, I don't think people understand the volume expectations. Treasure Coast Community Health did the first drive-through on January 2nd, and that day we immunized 510 individuals. We were supposed to be at 500, but once you go into a vial, you have to use all 10. And we had 2 show up late, and we took care of them. And then, wow, there was no problem finding 8 other people. But, we said, come back in 28 days, we'll call you, but it will be at the same time and hopefully at the fairgrounds. Well, the fairgrounds are busy on this Saturday. So we moved to Sunday.
Okay.
We have been calling people, but do you know how many phone calls have to be made to physically connect with 510 people? You get no voicemail or just a number of different logistics problems. So my apologies to those of you who still haven't been called, but you will be. But know that we honor our word. Everyone will be taken care of. And those that followed January 2nd, again, it takes a lot of time to have volunteers or staff members, it doesn't matter who, call all the people that showed up to reassure them that they'll be in for number 2. You will be. You absolutely will be.
And that's just one example of the process.
Yeah, exactly.
I mean, just one small example of this whole process of what's going on. And so, again, I think overall our healthcare community has done a great job. Yeah. And, there hasn't been perfect. We had some bumps in the road, and we'll continue to have those. But I think that the goal is there, and we'll continue to do it until we get to the goal. And
Florida is still right up at the top of the states that have distributed to those over 65.
Yes. Mm-hmm.
So, and we know that because we learned a new term, vaccine tourism, which now has been cut. But as you say, we're learning as we go along. So
yeah, we are.
So tell us what's going on Three Corners. That next to COVID, that seems to be the most popular Vero Beach discussion.
Well, the Three Corners is, of course, the power plant, the water treatment facility, and the corner across the street, the old post office annex building. And it's back up and rolling now. It had a little hiatus there because of things happening. People weren't meeting and doing things, but we're back up and rolling. The steering committee met in January again. They'll be meeting again in February. They're trying to put together a list of things they want to see on that piece of property based on answers they received from the public. I want to roll back into probably February or in the end of last year. I was very, very pleased at how open the meetings were. Okay. And I think that was important to have a number of meetings at different locations and make it open to everybody to get their input in. So that was very important to me. That was my goal, and we did it. We just got down almost the last vote when the pandemic hit.
Good old March.
They came out with a post-pandemic plan. They wanted to add to the list, which was very different. And so we've had to take some time to think about how we mix the two together. And of course, then we stopped meeting for a while because of COVID and meeting restrictions. And so the governor lifted all those on committees and councils and commissions that fall under the Sunshine Law, I think back in September, October. So we reformed the committee again and started back up. I think they met in December. They met in January. They'll meet in February again. I attend all those meetings, and they're up and running now.
That's great.
So we're looking forward to that. The goal is to have something decided by council by April or May, or they'll bring it back to council by April or May.
So you've got some timeline.
We do.
Speaking of which, I think we need to take a short break for a word from our sponsors. I think we kind of rolled past our midpoint.
Okay, we can do that.
Great. Hi, I'm Vicki Soule, CEO of Treasure Coast Community Health. Treasure Coast Community Health has been serving Indian River County for 25 years. How did we get here? It took a commitment to you to provide you with the most affordable, high-quality, integrated network of healthcare available anywhere. It took board-certified doctors and dentists and a dedicated staff to ensure that you receive the best possible care. It took more locations to meet the need, and now TCCH has 7 locations, with the latest one conveniently located down the street from Cleveland Clinic Indian River Hospital. Our services are available to everyone, whether insured or not. And at TCCH, no one gets turned away due to an inability to pay. We rely on donations from generous benefactors to continue our much-needed work. We accept Medicare, Medicaid, and almost all insurances. Call us at 772-257-8224 or visit us at tcchinc.org.
It's time to call Easy Brew Coffee and Bottled Water Service and learn just how much you can save and how convenient it is to have your coffee and bottled water delivered right to your home or office. In addition to water coolers, Easy Brew offers individual bottles of water in 8 or 16-ounce bottles. No more lugging it home or dragging it into the office. Serving the Treasure Coast for over 2 decades, 2 letters, 1 simple name. Easy for Easy Brew. Visit e-zbrew.com or call 800-792-3285. Easy Brew.
Take a new direction with your pest control needs. Call Compass Pest Control. Hi, I'm Chris Hudman, co-owner of Compass Pest Control. We're not your ordinary pest control company. We have over 60 years of local experience. We know service after the sale is the most important part of our business. Call us at 925-1740. That's 772-925-1740 or on the web at compasspests.com. That's compass, P-E-S-T-S.com.
And welcome back to Community Conversations. If you're just joining us, this is Vicki Soule. And this week I have a very special guest. Of course, all my guests are special, honestly, but I have special fond feelings for Robbie and his family because of a long association of our businesses. And Robbie, as a City of Vero Beach mayor, is updating us on a couple of things that you might have seen Coffee with the Mayor, or you might have been able to go to a city council meeting. But since the city council and the county commissioners meet on the same day, hint, hint, it's really difficult to be 2 places at once. I'm hopeful that someday they'll reconsider that. But we have Robbie here to kind of fill in the blanks for us. Thank you,
Vicki. And before the break, we were talking about the 3 corners. Mm-hmm. And, as I was saying, it's moving along. We have a timeline. We hope to get it back to council sometime in the spring, April, May. And then my hopes is that we'll have it on the referendum by November.
That would be awesome. That is the biggest past to future thing that we've got going in this county.
Yep. And so past that, everybody gets excited about that. I do too. I want to see that come to full circle. But past that, then we probably have about an 8 or 9 month time of rezoning. Because then we have to rezone it to match what the committees and what the council wanted to put on there, whether it be a restaurant, whether it be a hotel, whatever it may be that way. And so we have to go through a lot of public hearings to rezone something like that. But we'll keep the ball moving forward the whole time.
So I apologize. I should have done my research better, but my time frames are already squeezed with COVID. That's my excuse, and I'm sticking to it. So you talk about the treatment facility. Has that been shut down, or its functions already transferred, or will that be part of that 9-month pause button, if you will?
Well, actually, the way it'll probably happen is the first part will be the north side only, north of the bridge, because the power plant has been shut down. Right. And so it's ready to either be redeveloped into something or being torn down. Okay. And what that decision will be made by the people we work with, yes. Yeah. The water sewer treatment, we have made a commitment to take it offline, but right now we're in the design stages of a new one. That'll be a year process, and then we'll have to build stages, which will be another year. And then probably a 3 or 4 month time to switch over. Okay. Well,
I can tell you, driving down Indian River Boulevard last week, sooner is better than later.
I agree. When that was built there, who would have thought we'd have a bridge going right between the 2 buildings? It was all wooded area. The boulevard kind of ended there at that time. It didn't go all the way through, so it seemed like the perfect place at the time to do it. Yeah. But in the end, it was not the perfect place, and the sooner we get that off our lagoon, the better we will be.
Yeah, that too.
Yeah, so that's the goal for that. And then some of the talk by the steering committee and the original plan was to kind of just leave South Side as is. Youth Sailing they're there now, and they'll probably stay there, but the rest kind of mothball and let the next generation decide what to do. That's one thought. The other thought is you continue to develop it. But we'll see what the steering committee says.
Well, there's not as much on the west side of Indian River Boulevard as we originally expected because, of course, we had to make accommodations for FPL there instead of Vero Beach Electric.
I think there's about 1.5 acres over there.
Okay.
And probably that will not have anything to do with the main sites, 2 sites in the end, because getting citizens and individuals from one side to the other on a 6 or 7 lane highway is not an easy task.
So true.
So that probably will just be used for something different or sold off. We don't know yet. That piece of property is not protected by the charter. So if council decided to sell it and use some of those funds for the project across the street, we could do that.
Good information.
But we'll see.
Most of us didn't know that, I'm sure. So then we come back in our last couple of minutes. Any positive news about the perennial parking situation up on the beachside?
Well, as I tell people about the beachside parking is that we have high-class problems.
Yeah.
When I grew up here, you could take a shotgun and shoot it down Ocean Drive on a Saturday afternoon at 2 o'clock and not hit a soul or a car. So we now have a situation. We've created a good problem. It is a problem, though. And so we're going to, that's back on the table. Monty and I drove the beachside recently and looked at some options. And so we're going to put that back out and get it going.
That's awesome.
And then from there, the only thing we're going to do is we're working hard to set up some communication between us and the citizens. I don't think we have a good enough line of communication. We're very transparent in City Hall, but getting that information out to the citizens, who not just the citizens of Vero Beach, but as I call the stakeholders, because we have 16,000 to 18,000 people that are residents or citizens of Vero Beach, but we have about 100,000 that call Vero Beach their home on their address.
That is the truth.
So, that
is the truth.
So we have to communicate with our stakeholders too at that time.
Okay. So you were doing that by collecting email addresses, is that correct?
We already collected a number of email addresses. We also want to get in touch with them now to make sure that they are okay with this. We collected those back when we were getting information for the 3 corners. Okay. And they were putting input in. So so far, nobody has asked us to take them off the list yet. So we're working on that. Staff is working on putting a timeline on how quickly we can start this process. There's a couple different ways to do it. Yeah. Constant contact is one of them everybody's familiar with. And we can put newsletters out. We can put information about vaccines and COVID, and we can put information out about hurricanes. We can put information out about all the good stuff that happens. Because there's a lot of good stuff that happens that we don't know about. The police department does a lot. The utilities department does a lot. So it's just a lot of good information out there we need to get out to the general public.
Well, if I could do anything at all on behalf of Treasure Coast Community Health, please let us know.
We will.
Because Vero Beach is certainly a huge part of the population that we take care of. Not to ignore Sebastian or Fellsmere, guys. I'm not playing favorites here. But we certainly know that we have a lot of people who reside or affiliate themselves as being Vero Beach residents, whether they're technically in the city limits or not. So.
And that's one of the most interesting things I learned when I first came on board is that statement. Monty told me that, made it very clear, and I have a lot of people that call me that think they're city residents.
I did.
Because they think that Vero Beach is their address. And I understand that, but I never thought about it in terms like that. I understood it because until 2015, I never lived in the city. I lived in the county, but I always had a Vero Beach address. And so we knew then.
Okay. Well, again, once you figure out how you're going to collect more addresses to get more people in the loop, please let us know. We'll put in our constant contact, and we'll get that ball rolling for you. But again, we're sort of the little town that's grown up, but some of our infrastructure can be fairly easily overwhelmed as we design new processes.
Yeah,
so
it is. There's no doubt about it. Most of the Vero was built out in the 70s. That was before stormwater retention was required. It was before a lot of things. Things have changed. We have groups of people like St. John's and Inner Farms. They were set up to drain water off, dry the land out, dump it into the lagoon. We've learned now that's not the best way to do things.
Right.
And so we have to back up, rethink our process, and start changing.
And be willing
our plans.
to change.
Exactly.
Yeah. I think that's the main thing. And I know that sometimes the changes can be overwhelming, but for the most part, if you take a deep breath, step back, take another deep breath, and think about it. I tell my staff, I do my best thinking at 3 a.m. When I wake up at 4 a.m., my brain has processed it all out, and it's like the light bulb just goes on. Wow, I struggled so hard yesterday with that, and now I have an answer.
We have a lot of individuals in this community that we can make this happen. If we all put our heads together and work, a lot of great individuals here that have lots of talents.
So thank you. That's a happy note to end on, and that's what we're going to do. And say thank you to those of you that have stuck with us to the end. And next week, I'll bring another wonderful guest to the table so we can have another great conversation. Thank you, Robbie.
Thank you, Vicki.